we're gonna do an ankle series now. So our standard ankle series consists of an A to P, a medial oblique, and lateral views. So we are no longer using the bucky tray, we're just going to be using the tabletop. And from this point forward, we are doing away with the tan cassettes. We still want you to know what view requires detailed versus non-detailed cassettes. That's fair game when it comes to written testing time. So I'm going to use a black cassette on the tabletop. The biggest change here is instead of using 40-inch image grid, you have to go to tabletop. So all of these views are going to be at 40 inches, but I am now at the tabletop. For the A to P ankle, I'm going to place my central ray 1 inch superior to the ankle mortise joint. In the lab manual, it says that your cassette needs to be crosswise. That is specifically when you're trying to do multiple images on the same film. We're not doing that here in lab, so we want to put the long axis of the lower leg parallel to the long axis of the film, so we're going to go lengthwise on this one. My central ray is correct. The biggest thing when we're using the tabletop, since there's nothing to actually lock the cassette in, you need to have the lines of the central ray both horizontally and vertically lined up with our black triangles on our cassette. So I still want my image to be perfectly centered. Our ID blocker needs to be out of anatomy. The ankle is dorsiflexed to 90. They say to internally rotate 5 degrees. The main thing is that I want the second toe pointing right up to the ceiling. So I don't want somebody very externally rotated or internally rotated. I want them in a good neutral position. I put my Mitchell marker, actually I will collimate first. So you want to collimate to film size lengthwise, and then horizontally you can come into soft tissue, and then you can put your Mitchell marker right in our collimation field out of pertinent anatomy. Don't breathe, don't move. That's our A to P ankle. When we go to do a medial oblique, the patient will medial oblique their ankle. I'm going to actually flip my cassette around for this one so that my ID blocker is not in any pertinent anatomy. So my central ray still stays the same. So I'm going to be 1 inch superior to the ankle mortise joint. I am lined up centrally on my cassette. We're medially obliqued. Don't breathe, don't move. Cassette orientation stays the same. FFD stays the same. Okay? For a lateral ankle, you can have the patient bend their knee and they'll put the lateral aspect of their foot. Yep, perfectly. So just how Dr. Zapay just positioned herself so that the long axis of her lower leg still lines up with my cassette. Since this is an ankle view, I'm not too worried about the toes. So my toes can be cut off in this view. If I needed to check the toes for any fraction or anything like that, that would be a foot view or a dedicated toe study. So for my collimation, just under film size, you can collimate in slightly horizontally to include soft tissue. Don't breathe, don't move. Make sure your Mitchell marker is still in the collimation, but not within pertinent anatomy.